for the glory of old state, for her founder strong and great, for the future that we wait. Raise the song, raise the song.
Where else would you rather be? I'm Paul Clifford, CEO of the Penn State Alumni Association, and welcome to the People of Penn State podcast. Each week on the podcast, you can expect to hear the voices of Penn Staters talking about what they're passionate about, and you can expect to feel the pride and the power of the Penn State network. The People of Penn State podcast can be found on Apple Podcasts or your podcast app of choice. Subscribe and give us a rating. Ratings and reviews help others find these great stories. And we have another one to pass along to you today. I am joined by Dr. Albert Coe. He is a highly qualified and experienced doctor in the field of plastic surgery and aesthetic care. He has over 30 years of experience and has performed thousands of surgical procedures. He completed his undergraduate studies here at Penn State, obtaining a bachelor's from the Eberly College of Science in biology. His medical degree is from Drexel School of Medicine. He completed a rigorous 5-year general surgery residency training program at the Graduate Hospital in Philadelphia. And while at the Graduate Hospital, he served as the administrative chief resident in his final year and was named best teaching resident 2 years in a row. This was followed by a plastic surgery residency at the UMass Medical Center in Worcester. As part of that training, he spent 3 months at the prestigious Lenox Hill Hospital in New York City. Please welcome Dr. Albert Coe to the People of Penn State. How are you today, Dr. Coe?
Paul, I'm great. Thanks for inviting me, and I'm looking forward to this. Should be fun.
Yeah, I look forward to talking to you about your Penn State experience and about your journey to medical school, which I think is kind of an unknown journey for a lot of our audience. And so I think we'll be able to shed some light on that. But let's start right at the very beginning. How did you become a Penn State Nittany Lion?
Yeah, so I grew up in New Jersey. I went to high school there. And when I was applying to schools, I kind of wanted, I think, that big college experience. So I applied to Penn State. I actually only applied to a handful of schools. And I remember it well. It was spring of 1981, and my parents drove me out to State College. And, we're driving through farmland. We're driving past Williamsport. We keep getting deeper and deeper into Pennsylvania, a state I had really never explored. Back in those days, Route 99 didn't exist. So you had to get off at Route 26 and drive about 20, maybe 30 minutes down 26 to get to State College. And, the old joke was you have to drive past the state pen to get to Penn State because the penitentiary is there. And we arrived, pulled into College Ave. We parked the car. It was a beautiful spring day. I think it was right after, a long, typical Happy Valley winter. And we walked up onto the hub lawn, and there was just kids everywhere. People were sunbathing, playing Frisbee. Dogs were running around with bandanas on. And I knew not much else about the school, to be honest. And I just said, I fell in love, and I said, this is where I'm going to school.
Yeah, it's amazing. I grew up in northeastern Pennsylvania. So you took that path from New Jersey kind of right through my home area where 80 and 81 crisscross. And I remember as a kid that Penn State was about 2 hours and 45 minutes away. And then it got closer. It was only 1 hour and 50 minutes away once 99 was put in. And so, I remember that trip down Route 26 very well. So you decided you picked Penn State. What were you involved in as a student here?
Yeah. So like a typical student back then, you want to explore and do a lot of different things. The organized thing I did was I was a Big Brother in the Big Brother program for 2 years. And I had 2 young boys we had a single mom who were living in Bellefonte, as they say. And that was a great learning experience for me. And then I did other things. So, for example, I was the intramural athletic director. And what the heck is that? Well, the dorms and the Greek system, they had a lot of competition through intramural sports. And, back then we fielded teams. So the 2 floors of our dorm We fielded teams in softball, soccer, individual sports like tennis, et cetera, et cetera. And then we competed against each other, and they kept score. And I can tell you, it was very competitive. For example, the softball team I fielded, every kid had played varsity baseball except for me. So that was your typical experience. And, we all had competitive juices flowing. And, I'll tell you a funny story. We had a ringer. It was a tennis player who decided not to play in college, and he ended up winning. And we got so many points that at the end of the whole thing, we got ranked pretty high at the end of that. But other things I was involved in personally, I did club racquetball, club badminton. I was the unofficial social director of our dorm floors. And I remember this is the early 80s when the drinking age was still 18.
Sure.
So you were allowed to have an occasional beverage in the dorms, let's put it that way. And we would have parties, and I would organize them and get the music together, and invite people. So that was what I did.
It sounds like sports has been a big part of your Penn State experience, a big part of your life. You were here during maybe the golden era of Penn State football. Any memories from the 82 national championship team, or all the way up to that run, the 85 team, just stopped short of a national championship by Oklahoma?
Yeah, absolutely. I tell you what, that 82, that magical season, of course, as students, we went to every game, the national championship, it was such a huge thing. It was such a big deal. And remember, and for, most Penn State fans are very familiar with the undefeated seasons that weren't crowned national champion, and the one that was taken away, so to speak, by a former president, right? So that 82 season was magical. Kurt Warner and Todd Blackledge, you saw these guys on campus, they were everywhere. Jonathan Williams lived across the hall from us in the dorms up until he was a junior. So, you knew these guys. You went to the dining hall with them. You walked to classes with them. They weren't isolated, as I believe they might be in some places. Even in the library, the kids who were, had to maintain a certain grade, they were all there with, studying as we were, and that was a great time to be, educated in Penn State and college football.
Absolutely. Look, it was the era of 48-14, right? We go down 14 points to Pitt in 81, and then run off 48 straight points.
That's
to
right.
Follow that. Doug Flutie made a couple of appearances in Beaver Stadium, Heisman Trophy winner, played
right.
Notre Dame several times. And so I know I personally have some great memories from that era of Penn State football.
Yeah, there was a game against Notre Dame. I don't know if it was the 81 season, but it ended with a goal line stand in the blizzard, and it was 1st and goal to go for Notre Dame, and we blocked them 4 times. I remember that. That may have been the next season, but it was just something that was so magical. And tearing down the goalpost started in that era. I don't think they do that anymore, or it's frowned upon. But I think that happened 3 or 4 times during that 82 season.
So when you came to Penn State and majored in biology, was medical school the ultimate goal, or were you just interested in the sciences and you didn't know where it was going to take you?
In the back of my mind, I think it was always there. That seed was planted when I was in high school, I think. And, there are no physicians in my family. I didn't have any personal experiences with, say, an orthopedic surgeon or a pediatrician or something. It's just something that I think was brewing in the back of my mind. And as I came to Penn State, you explored it a little more. You joined a pre-med club. You met other kids who were thinking of applying to med school. It wasn't like it is now, where there's so much exposure for kids, right? Just from the media to being an EMT, et cetera, et cetera. There wasn't a lot of that. You had to go out and find and create your own experiences. Yes, I did volunteer at what used to be called Center Community Hospital. I logged in a good 400 hours there, but not because I had to. It's just because I wanted to be exposed to the medical environment and to learn what goes on inside of a hospital. So I would say that, it wasn't an exact goal, but it soon became one once I was there.
This is the People of Penn State podcast. I'm Paul Clifford. I'm joined today by accomplished surgeon, Dr. Albert Coe. So, when we think of medical school, as somebody who hasn't gone through that process like myself, we think, 4 years and you come out and you're a doctor. but it's really much more than that, right? It's a 12 to 16 year journey for many who are going into specialty areas. Talk about getting into medical school and the perseverance that took, and then walk me through your journey through your residencies and all the training to finally be able to practice the medicine that you were studying.
Sure. How much time do we have?
3
Okay.
minutes.
All right. So here, I'll give you the 3-minute version. Okay. I once filled out an application that asked, how many years of schooling and formal education have you had?
Right.
And I added it up. It's 30 years. And people say, that's not possible. And I said, yes, it is. 12 years of, first through 12, 4 years of college. I did 3 years of graduate school, 4 years of medical school, 6 years of general surgery training, and 2 years of plastic surgery.
Right.
That is 30 years. Now, the part after college, really, right? So medical school, general surgery, and plastic was 12 years.
Right.
So you're forever a student when you decide to go into medicine, right? Whether you become an internist or a surgeon or any other field in between, you're going to spend the majority of your young life training and learning and educating yourself to become a doctor. And I think it's one great thing about our system here in the US is that we train the best, right? When people from around the world need some kind of advanced procedure or surgery, they almost all come to the US. And it's because I believe of our innovation, of course, all the great hospitals we have, all the great research that's going on. But mainly, I really truly believe it's because of our training. We train our doctors in a way that prepares them for anything. And whether you want to work out in a rural community or work in a tertiary care hospital in a major city, you all go through the same training to become certified in your specialty. So that I feel is something I feel very strongly about and passionate about, that anyone who wants to go into medicine, you better be prepared for the long haul. It truly is a marathon. Briefly, and when I was in medical school, I decided that I liked doing procedures. I like using my hands. So that meant some type of surgical specialty. And then I started in general surgery, not knowing specifically that I wanted to be a plastic surgeon. I thought maybe I would just go into general surgery and see, where that took me. And it was a Saturday. I remember the day, the event. It was a event held at the hospital of the University of Pennsylvania, where they had some plastic surgeons coming in, and we're going to give a talk to medical students who were thinking about perhaps a career in plastic surgery. And about 8 speakers got up one by one, and they talked about such diverse things that I couldn't believe it was one specialty. One surgeon got up and talked about replanting a hand on a farm accident patient. Another surgeon got up and talked about doing a facelift. Another one got up and talked about burn care on someone who was burned over 80% of their body and walked out of the hospital. Another one got up and talked about breast augmentations. And I thought, how could this all be the same specialty? Right. And that's kind of why I chose plastic surgery, because it truly is general in the sense that before I go into a room at the hospital to see a patient, I don't know if it's going to be a kid, a middle-aged person, or an elderly person. I don't know if it's going to be a cancer, a wound, or just some cosmetic defect that they're not happy with. So it's really, truly broad-based, and it's what keeps every day new.
Yeah, you talked about, and we talked a little bit off air about there being really a lot of diversity in this particular specialty, but you could go down really one of two paths, right? There's the cosmetic path or the reconstructive path, or in your case, a little bit of both where you are in your career. But I think the part that that people, that I'm certainly interested in is the reconstructive part, right? Someone's been through a real traumatic incident, and you help them not only to regain use of parts of their body, but also kind of regain a lot more mentally and psychologically. Talk a little bit about those two paths and kind of the the difference between both and kind of the rewards you get out of that reconstructive path.
Yes, absolutely, Paul. plastic surgery, even the name of our specialty, plastic surgery, I think throws a lot of the lay people off. They think it has to do with plastic, or the material plastic, or the artificialness of plastic, or what some of us, do as cosmetic surgeons. But in actuality, the term plastic is from the Greek plastikos, and it's to shape or to mold. And that's what we do as plastic surgeons. Whether it's a deformity that's caused by injury or cancer or even a birth defect, what we do is we shape and mold the body by various means to get back to a standard, or to the way it should have been, so to speak, right? And every case, and particularly as you mentioned, the reconstructive cases are very, you put your whole self into those cases. You really want to help someone achieve normalcy or get back to their normal. And, by all means, plastic surgery, it's something as simple as, removing a lesion and closing it in a way that the scar is hidden and heals nicely, to, as we said, reattaching a limb. Okay. That would be the most extreme, or the most technique driven thing. For example, in the media, you've heard in the last several years about face transplants. Okay. Not an area that I do. That's microsurgery, but I was trained to do microsurgery. The folks who want to do that do an extra year or two of training and work at a major center. But in general, reconstruction is the bread and butter and the soul of our specialty. Although plastic surgery, I guess, has made us more famous. Right. And you can't go a day without seeing something on TV or Instagram about some celebrity or someone who's had cosmetic surgery and either botched or great job or great result. But that's really the two areas of our field.
So when you think back over the 30 years of experience that you now have in practice, what are some of the special cases that you've encountered that kind of make you most proud of being able to help somebody through that situation?
Sure. As plastic surgeons, we all have a few cases that stick out and that we remember for a long time. And some of them are dramatic, and some are not so dramatic, but just very, have a special place in your heart. I remember not too long ago, I had a young woman who had a skin cancer, and through the process of Mohs surgery, which is something that dermatologists perform to remove a cancer, to make sure that it's eradicated and completely gone. They then oftentimes will send those patients to us as plastic surgeons to perform the reconstruction. And this one particular case was a young woman. She was about 24 years old and came to my office after her Mohs procedure, walked in, had a bandage on her face and sat in my chair. And I went in. When I took the bandage off, I had to do everything I could not to, wince or make any kind of gesture to let her know that I was looking at something that was going to be very challenging. And what she had was just a very, very large defect on her cheek. And, you can't just close it. And just putting a skin graft on it would get it healed, but would not look great. So using some plastic surgery techniques, more than we need to get into here, but doing several procedures on her, I was able to get it to look pretty close to normal. Like from a conversational distance, you couldn't tell that it was even there. And it's funny because I had asked some colleagues what they would do. And, we all are creative in different ways. And most of them were opting for something very large, a very large procedure that would have been very disfiguring from the use of that type of procedure in and of itself. So in the end, she got something that was very, very cosmetically appealing, and of course, made her whole again. And it's one of the cases I think about from time to time when I need a little pick-me-up.
Yeah. I would imagine that there are really specific ethical topics that you run into in the work that you do, maybe even more so than other specialties within medicine. But talk about some of the ethical considerations that you have when some of this could be considered elective surgery, right? And how do you have those conversations with your patients around, being certain that this is the direction they want to go with some of these surgeries?
Yeah, I think there's a couple of things that I'm thinking about as you ask that question. One is, for example, the child that is born with their ears, prominent ears, okay? If any of us were to look at that, we would say, yes, that's not normal. It needs to be corrected. But sometimes insurance companies say, well, that's cosmetic, and, we're not going to pay for that. And, that's like a gray area. And there are some others. But so, if your child was born with very prominent ears, you would want them to not be picked on. You would not want them to stand out in school. You'd want them to have a, normal childhood and upbringing. So that type of case then crosses that line between what's cosmetic and what's reconstruction. Okay. I would argue that every case that I do, even a reconstructive case, has a cosmetic component to it, right? If it doesn't look good, it's great that it'll function and you can, have something heal. But if it doesn't look good, we kind of, as plastic surgeons, we all, look at ourselves and ask ourselves, what could I have done to make it look better? So sometimes in plastic surgery, we will do something to get a patient from one place to another, and that is, let's say, with something healed. And then after that, you might do some revisional procedures to make it more cosmetically appealing. As far as other ethical things, I mean, I think there are some ethical questions come up about face transplants, as an example. If you're going to take someone who's young and healthy and put them on immunosuppression the rest of their life, that becomes an ethical question. And whenever they have surgeries like that, there's a whole team, including sociologists, psychologists, even ethics people that are on these committees that go over those cases thoroughly multiple times before they would undertake something like that.
This is the People of Penn State podcast. I'm Paul Clifford. I'm joined by accomplished surgeon, Dr. Albert Coe. So I want to circle back to your Penn State experience, because it's now come full circle for you, as it's become a family affair for you and your family, in particular your daughters, class of 2018 and class of 2020. How did your kids going to Penn State kind of reconnect you with the Penn State community and with friendships?
Yes, absolutely. And actually, my younger one graduated in 2022, so she just graduated. Yeah. Well, it was a great thing. When my older daughter went, I had been almost, I guess, 30 years or so removed from Penn State. And, life gets in the way. You have your friends that you were so close to for that short period of time you're there. You might send a text here and there. You might get an email or something. But really, life takes us in different directions, and we kind of drifted apart. Well, when my oldest daughter went to Penn State, we started going back to a football game here and there. And because of social media, I was able to get in touch with some of my buddies, and we would get together and go to the same games and rekindle those friendships. And it was fabulous, because again, some of these people I hadn't seen in 20, 25, 30 years. And when it comes to my second daughter who went there, this is really cool. I have a picture of myself and my good buddy, Tom Chesnick, and his daughter Maggie and my daughter Sophia at a tailgate standing together. And there's 40 years of time removed between when we went there and they went there. And it's just one of those things that you can't make that happen, right? It's got to be organic. It just has to happen. And for them to be in the same sorority and have the same social circle, it was great. And I think that's the thing about Penn State more than anything. It's the people, right? The place is fantastic. The education's first rate. The football team's unbelievable. All the other sports there are fabulous. But really, it's the people you meet are what you're going to remember and cherish, I think, the longest after you leave.
Absolutely. We like to have a little bit of fun here at the end of our podcast and dig a little bit deeper into your Penn State experience. So let's just do what we call our lightning round here. Okay. What was your favorite class at Penn State?
Favorite class? Okay, being the science nerd that I was when I was there, I would probably say biology of aging. which was a class led by Dr. Mitchell, the great Bob Mitchell, who was also the pre-med advisor while I was there. And that was a class that introduced me to concepts and things that you never really thought about, like how does a tortoise age versus a bird versus a mammal? And, some things are just really cool in nature. I studied biology not as a means to get into medical school, but because I was very interested in biology. And to this day, you look around and you see things like bees or hummingbirds or the monarch butterfly. I mean, this is on and on. All these natural things in nature that you wonder how can they be? They're so great, right?
Right.
A close second would be, I think, Dr. Hollis's physiology course, which kicked a lot of our butts, but really taught us. That was as close to a medical school course that I took at Penn State. It was a physio class.
How about your most unusual "we are" moment? Either traveling somewhere, or you see a Penn Stater and you call out "we are," or vice versa. What is your "we are" moment?
I'll tell you when it just happened this summer. I was earlier this summer, in the beginning, I was on Route 6A on Cape Cod. And I was in this little coffee shop that my daughters love to go to. And I was in there waiting for the barista to make our coffee. And I heard over my shoulder just a very faint, "we are." It was a whisper. And I thought, I don't know what's going on here? Is this person talking to me? And then I ignored it, I'd be honest with him. And then it got a little louder. "We are." And I kind of turned and I realized that the gentleman was talking to me, but I didn't have any Penn State gear on it. I didn't think I did or anything. And then I realized I had my hat with the S on it, the state.
Right.
So it doesn't even say Penn State on it, but he recognized the color and the S. And of course, I gave him a Penn State back, and that sparked a 10-minute conversation that he was from Pennsylvania. His two daughters went there. I think somebody else, his brother had went there, and we talked about the current state of the football there, and it was just a really neat little moment on Route 6A in Cape Cod.
Excellent. How about your favorite Penn State sport?
Well, I think you have to say football, right? I mean, especially from my memories of being there and going back to games. But I will tell you that there were so many other sports that I was introduced to, their varsity sports, NCAA, that I had no idea existed. And here's one in particular: men's gymnastics. There were two, I believe, gymnastics rooms on my dorm floor. And I had the good fortune to meet and hang out with someone. And Terry Bartlett lived on our floor. He was a Brit going to Penn State, recruited, of course, for his gymnastics acumen. And he said, "Hey, Al, why don't you come this Friday night? We're having a tri-meet. I forget who was in town, Ohio State and someone else." And I said, "Terry, I'm not going to come to a gymnastics meet and watch you guys run around in your tights, right?
Right.
Knowing really nothing about men's gymnastics, right?" So he says, "Just come. I think you'll like it." And I went, and boy, what an education that was. Just that first time going, and it's so dramatic. And then knowing that these guys lived on my floor and they were doing these outrageous things that, pound for pound, they're stronger than the football players, right?
Sure.
I mean, who else can lift their body and on two fingers and do the iron cross on the rings? And Bill Stanley lived either on my floor or I believe a floor below us. And he was so famous. He already had a maneuver named after him by the time he got to Penn State, the Stanley, which is something on the pommel horse, I think, with swinging your legs. You know how they flip like this?
Sure.
Now, every male gymnast does it. That was called the Stanley when we were in school. So I'd have to say that was a really neat thing.
That's amazing. One of the iconic, truly Penn State sports is men's gymnastics.
Mm-hmm.
That doesn't get kind of the national notoriety like football might, right? But is nationally competitive.
Wrestling or, yes.
Right. Exactly. How about your favorite flavor of creamery ice cream?
Favorite flavor? I'm more of a fruit guy, not a chocolate guy. So I'd have to say peachy paterno. I love peaches, and I love more on that side than on the chocolate side.
Excellent. Well, Dr. Coe, I want to thank you for joining us on the People of Penn State. It's alumni like you who allow us to share their story that swells thy fame of dear old state. So thank you for joining us.
Absolutely. Thank you, Paul. Thanks for having me.
Absolutely. I want to thank our producer, Vincent Longaro, and our guest relations coordinator, Mara Ryan. If you like this episode, I hope you'll subscribe to the People of Penn State podcast in your favorite podcast app of choice. And while you're there, go ahead and give us a rating and drop us a review. Help us spread the word. Share the podcast with your friends and fellow Penn Staters via your social media channels. And remember to tag at Penn State alums when you do that. If you're a member of the Penn State Alumni Association, thank you so much for your support. If you're not a member, what are you waiting for? Go to our website at alumni.psu.edu, and you too can become a member of the world's largest alumni association. Thank you for all you do for the university, for the glory, and for the future. We are.
May no act of ours bring shame to one heart that loves thy name. May our lives but swell thy fame. Dear old state, dear old state.